Good morning and good evening. Welcome everyone to our distinguished Biomedical Engineering webinar series hosted by the World Association for Chinese Biomedical Engineers. My name is Bingmei Fu. I'm a professor of biomedical engineering from the City College of New York. For today's seminar, our speaker will talk about 40 to 45 minutes, leave 10 to 15 minutes for the questions. Please use the Q&A feature and the button of your screen to submit your questions. Today, we are very excited to welcome Professor Zhanfeng from University of Oxford. Zhanfeng is a Donner Pollack Professor of Chemical Engineering since the chair was created in 2000. He's also the founding director of Oxford Suzhou Center for Advanced Research, OSCR, a very nice acronym, an RD center owned by the University of Oxford, but located in Suzhou Industrial Park. Professor Cui was educated in China and moved to the UK after his PhD from Dalian University of Technology. He was a postdoc in Strathclyde University and a lecturer in Edinburgh University before joining the Department of Engineering Science of University of Oxford as a faculty member in 1994. He used to be called Bubble Man for heat transfer because he is a chemical engineering, but currently his research focuses on enabling technologies for regenerative medicine and bioprocessing. And today he's going to talk about the rapid test for COVID-19. Zhanfeng, welcome.
Thank you, Bingmei, for the nice introduction. So I can start, is that right, Bingmei?
Oh, please.
Yeah, okay. Thank you for the nice introduction. And really, I'm very grateful to Edward and the other colleagues invite me. It's just a pity we couldn't get together and shake hands. And so this is something I really miss. But it's good that we actually can see each other and at least say wave to each other in this webinar. Okay, let me start then. I will talking, share my screen. Okay, so I was asked to talking about our test kits because we have been working on this the COVID-19 rapid test in the last few months. And so actually, this is not our normal job, as actually Bingmei kindly introduced me. And I'm working mainly on bioprocessing and like stem cell therapy, that tissue engineering. And so this is actually in responding the pandemic. When I say responding, so nobody expected this. And there's make huge change, impact on our normal life. And then we have to change. We have to respond. Like now we have this webinar, for example. So you see, I'm the one actually standing up here to talk about the story. Actually, there's a big team behind this and working on it. And I particularly want to mention Professor Wei Huang. He's associate professor in our department and also a PI in OSCA. I will come back to OSCA later. And his research area is actually synthetic biology, okay? And looking at our postdocs, PhD students, none of them working on in vitro diagnostics. None of them working on this kind of RNA, DNA detection. And so when the pandemic, you see, when this thing hit us, so we dropped everything we usually do and get together and develop this rapid test. I think it's actually a really good example to show engineers we are open-minded because our strength is actually problem solving. And it really depends on what type of problem we want to solve or what phase was put on table for us. So I think this is actually, I keep saying, you see, our test is actually, this project is a good example for international collaboration, and also like to show our social responsibility. So I think as being introduced, like my normal, I wear the hat of chemical engineering professor. I run the chemical engineering program in Oxford, and we are quite new. We only started in 1993, the chemical engineering program at Oxford. And so I'm working on bioprocessing and the medical biotechnology, and tissue engineering, stem cells, or enabling technology, bioformulation, a lot of them related to bio. So we have nothing. I have no experience on DNA detection, RNA detection, or virus detection. But this thing is just suddenly adding on this. So people ask me why you started this, how you started this. So I will start with that little story. But then to do that, I have to introduce you, Oscar. I guess you all know actually Oxford University, okay, is the oldest university in English-speaking world. And we produced many prime ministers of the United Kingdom, you include the current one. We publish Oxford dictionaries. But we also have a very good medical school and a very good science and engineering base. So I'm not saying too much about Oxford, but I'd like to say a few words about OSCAR. So OSCAR standing for Oxford Pseudo Center for Advanced Research. And this is actually a project, collaboration project between Pseudo Industry Park and the University of Oxford. So this project started probably at 2012. And we signed the MOU on 2013, take nearly 6 years, more than 5 years, and to get opening. So it's opened on 22nd of November, 2018. That day was the Thanksgiving Day in the US. Our Vice Chancellor, Professor Louise Richardson, she is American. And so she said, okay, it's the only time I have to go to China without not to go in my family to Thanksgiving. That's why I remembered that. So when we opened this building, it got a big splash because this was the very first center of Oxford University outside Oxford, UK. For even no other places we have this. So it's quite a big story. Not just to Suzhou, to China, and also to Oxford ourselves. So the center is the university's first overseas center for science and engineering. And then it's actually the one important thing is not a joint venture, is 100% owned by the University of Oxford. It's just like another department, but it's just happened to be 5,000 miles away. So I initiated the project, and I was appointed the first director of the center. So the way we work is that all the PIs are actually Oxford permanent professors. And this is from, we call AMPLS, is mathematics, physical, and life sciences. So the university in Oxford divided into 4 divisions. One is the mathematical, physical, and life science division. One is the medical science division, and the social sciences division, and the arts and the humanity. So 4 divisions. So then we have 4 directions: biomedical engineering and healthcare. This is very relevant to our seminar, our audience today. And environmental biotechnology, nanotechnology, functional materials, and the quantitative finance. So we choose these areas because we have strong research interest and the reputation in Oxford, and also Pseudo Industry Park and also Suzhou area has a strong base, industry base for it. So the PI is from Oxford, and we employ postdocs all around the world, just like we do that in Oxford. We have a supporting team. So it's working on just like a department in Suzhou. We also have visiting professor program. And so I would, if our audience, our collaborators have interest to spend their sabbatical in Suzhou, and please let me know. Then we have a large visiting program, visiting professor and the visiting scientist program. It's brand new. It's a new building of 20,000 square meters, 200,000 square feet. And so it's all decorated. Because it's a new building, we can do whatever we like. We like to present Oxford to a forward-looking institution, not just have an institution with nearly 900 years history on the back. So we also focus on science and technology. Right, so I don't know what happened when it's running back. So OSCA is actually a showcase for international collaboration. And now it's actually, we're actually up running for nearly 2 years. We started to produce great science outcome and the technology transfer. And what relevant to this talk, this is OSCA is where our test program started. Without this OSCA, if we don't have this program, probably we will not start this at all. So this is why I spent a few minutes discuss OSCA. So this is how it started, right? Just before Chinese New Year, the Chinese New Year is 25th of January. And that time, you see Wuhan started locking down. And then China is in high alert. So our researchers leaving, you see, we return from China, from Suzhou, back to the UK for Chinese New Year holiday. And then when we passed in Heathrow Airport, we noticed that there's no check, any check at all. So no matter temperature, did not ask any questions, you just walking through. We said, this is not on, we really needed to do something. And so to control the spread of the disease. And another very important motivation for us is that because our OSCA is in China, we've just felt we are obliged to do something for China, right? So we can't just say, okay, we run back to Oxford, we are safe, but our colleagues in China is in lockdown. And we said we needed to do something. So on 24th of January, that is Chinese New Year, few of us, our colleagues, we get together, have a drink, and we said we need to do something. And we are not a medic, so we can't do much in medical recovery or drugs, that type of thing. We can't do anything with vaccines because Oxford get a strong vaccine program anyway for any vaccines. So we said let's start to do a test program. So we said let's do the test. And because this is our start from the airport, so we actually at the very, very beginning, we said what we need as an airport. So, and then airport want to test the people whether it's getting virus, getting infection or not, right? So get the antibody or not is less important because you want to control the spread of the disease. So in this way, so to test this COVID-19 test, you can see in the every day is on the news. Basically, there are two groups of tests, and then the first one is to test whether one has the virus and whether it's infectious. Okay. To test this, there are two methods. One is molecular test or a nucleic acid test. This is commonly we see in the television, taking a swab, and then you test that in the lab to use the RT-PCR. Because this COVID-19 virus, SARS-CoV-2, is an RNA virus. Okay, this is RNA virus. Then you can use reverse transcriptase to convert that into DNA and they use the PCR, polymerase chain reaction, cycling reaction, to amplify the minute amount of DNA particles and into a lot, so to the range you can detect easily. So that's RT-PCR. And it's very accurate because you actually can amplify many, many times. But then it's slow, okay, and they need machines. The other type of test to test this virus is to use the antigen test. This was in the news a couple of weeks ago. Abbott released this $5 antigen test, right? It's cheap, but the antigen test tests the virus-specific proteins, and you can't amplify the proteins because if you treat that, if you do treatment, the protein will denature. So you have to find a way to test the very, very dilute solutions, very tiny amount of the proteins. So therefore, usually antigen test is far less sensitive and far less accurate. So compare with the detection limit, antigen test probably at least 1,000 times lower, worse than the nucleic acid test. And of course, the other test is antibody test to test whether somebody get antibody in the blood, and just to show whether the individual got infected before. And they used to believe if you got antibody, you will not infected again. So you can feel free, go to work, go to parties. But then the new evidence showed actually people get infected again because this virus seems very clever. So then we back to our initial thinking of test passengers at the airport. So basically when passing Heathrow, you get off the plane, even the closest the gate, you get off the plane, get to immigration, and at least take 30 minutes. So that's why we decided actually we needed to complete the test from end to end within 30 minutes time. So you get off the plane, that time is we think very naively because there's no established method and nobody knows this type of thing, what happened next. This we're talking about 7-8 months ago. Now, so at that time, the thinking is off the plane, you take a sample and then do the test. When you get the immigration or baggage reclaim, you are told whether you go to isolation or okay, it's safe, it is clear. So that is actually just 30 minutes, that's we put it there. So we need also, we don't have time to send it to the labs. So have to get quick testing method at that spot. So this is like, in engineering terms, this is like a product design exercise. I think we are all engineers, we actually get this product design principle. You identify the needs and the gathering ideas, select the most likely successful idea, and you do test. And if work, go to next step. If you don't, go back to check another idea. So if the idea even work, you can see whether you can scale it or not, because we're talking about industrial scale production. And if not, you go back until you can finally get the manufacturer to get a regulatory approval, access market, right? It's a product design exercise. So we just need to, let's identify the need. This actually all at the very beginning is from the airport setting. We want to only detect the virus, is portable and can be used anywhere because any terminal, any gate, and test time must no more than 30 minutes. And then we don't need to transport the samples, no labs, no special instruments, you don't have a PCR machine, and easy to operate because this would be a decentralized testing or so-called point of care testing. Right, so we can actually test the individual, but we should have a certain quantity or throughput for the application. So let's go back to say, how is tested now? Okay, this is a standard RT-PCR. So basically, you collect a sample, and the standard way is to get a swab solution. You can see people on the car park, in hospital, or actually they now send the swab tubes go to your home, and then you can actually looking at the YouTube video to see how you do it. You can self-sampling, but the important part is that collect all the samples, send to the lab. When you get to the central lab, usually it's the biosafety level 3 lab, because the samples potentially had virus. And then you do RNA extraction, and then you go to the put in the RT-PCR machine. And the RT-PCR machine takes at least 90 minutes, sometimes 2 hours, to run the sample. So the samples stay in the lab from beginning to the end, and probably nearly 2 hours, excluding any waiting time. And then also the main time needed is to transport the sample, actually from taking the sample sent to the lab. And then if you have a backlog, and then usually you get to the lab, they're not tested at then, you have to wait. So in the early days, we all heard the horrible stories, people get the results in 2 weeks' time. But then by then the test is meaningless. But the key message for this is that this is actually a slow and expensive process. Okay, slow is one of the main things, and quite expensive, and they need labs and they need the machines. And so is in some like developing countries, probably they don't have this infrastructure. So what we developed? We said, no, we can't use PCR because it's too long. Then we're looking at, based on the product design principle, we looked at all the different ways. We see as antibody test, antigen test, what can meet the need to accurately detect whether the individual got a virus or not at that particular moment. So we actually we found this LAMP technology. LAMP stands for loop mediated isothermal amplification. It's not new at all. It's invented 20 years ago by Japanese scientists. And it's fast, it's only need one temperature. Unlike PCR, you have heating up, cool down, heating up, cool down. This is an isothermal, 65 degrees centigrade, and then you can actually detect, you can run the amplification of DNA. And then the entry level to LAMP is quite low, actually. Most molecular biologists can do it because you actually design a primer, because all the sequences of the virus is published. And then you can go to get a company like Integrated DNA Technology. They can get your primer, and then you can go to New England lab, biolab, you can buy the enzymes, they all pre-mixed, and you adding them together, it will run, it will react. So it's very, very simple. But you think, and it's fast to detect the virus. So you ask me, why on earth in the last 20 years, this technology not used much? And then you see, it's still the dominant way is PCR. You see, despite all these advantages. Now, the reason is that LAMP reaction is very difficult to control. And then for this test, you got a large number of false positives. Okay, so false positive is a headache to this technology. So that's where actually our main contribution is. Actually, we have this Professor Wei Huang, I mentioned, he's a molecular biologist. So if in this molecular biology domain, we contribute 2 aspects. One is that we designed highly specific primer sets. So this can only detect SARS-CoV-2, only this virus. The second part is actually, we actually designed a molecular switch. The Professor Huang designed the molecular switch to control the reaction. So the reaction only occurred when we want them. So there's no unspecified reaction. Therefore, we completely eliminated the false positive. And this all patented technology now. We patented this, and we give a name called OXLAMP. So it's not just a lamp, it's actually modified. So apply OXLAMP to do this COVID-19 test is very simple. So it's a 3-step operation. So we get sample, okay? Sample, you see, initially is all swabs, but then we now can use saliva, we can use mouthwash. And so we're adding the sample directly without RNA extraction. This don't need to go to the lab at all, because all the reagent, everything we need, we're adding into a PCR tube, this 0.2 milliliter PCR, standard PCR tube. And then we just adding the sample directly to the tube. So all the reaction happens in the same tube, one small tube. The only thing we need to heat it up at 65 degrees. And then so we can use hot block, we can use oven, we can use thermal flask, water bath, anything. And then as long as you can keep the temperature at 65 degrees for 30 minutes, okay? And so this is actually, so how accurate you need to be, is a couple of degrees up or down is all fine. For positive test, usually the reaction, you can, under the 3-step is check a color change, right? So if the color turn into yellow, from pink to yellow, that's a positive test. In other words, this individual got the virus. And if remain in pink, then it's negative, so no virus. So usually the positive results will display in about 10 to 15 minutes. Under the negative one, we want to make sure the negative is a true negative. So we run the experiment, we recommend to run it longer to 30 minutes. Okay. So it's very simple looking at the color change. So that's 3-step operation. So it's fast, 15 to 40 minutes from end to end. It's in situ, we don't need anything, no need for specific equipment, and no expensive procedures, very simple. A big step is direct use of swab solution or saliva solution. We just eliminated the RNA extraction. And easy to operate, okay, just one temperature control. And we have dual results display, colorimetric, change colors. We can also use fluorescence to display. Because actually in hospital setting, they like to have fluorescence because that reading can link to the information management system. They have the machines. It's very sensitive and it's only measuring, only detect this virus. And an important contribution we made is to get all the reagent, put them into one single tube and get it dried. So in this way, we eliminated the need for cold chain transport and storage. For people working with PCR or PCR test kits, and you know, at the moment, all the PCR reagent enzyme needed to be transported and stored in a cold chain, in a fridge, right? You have to store in the fridge. Then ours, we can put in the envelope and post it to any part of the world. So this is ideal use in the field. Basically, is we're not competing with central laboratories. So this is like in GP clinic, airport, nursing homes. At the moment, there's a big need for this type of test is in schools and school reopening, and also our university reopening. Important question is whether it works or not. So we did actually the clinical validation with direct swabs in our own hospital here in University of Oxford, John Radcliffe Hospital. And we use positive and negative combination, different ones. And then compared with the direct swab test in RT-PCR, okay? And then if you can see the figures and the performance is equally well comparable with RT-PCR, but with much shorter time. So we can run 30 minutes and the RT-PCR run 2 hours. So that's a different, that's even longer, you see, in this case, 4 hours. And then if you run it with extracted RNA, the accuracy is much, much higher because you see, you purified it, it's far less uncertainties. But for our test, because we like to do POCT test, Therefore, we use direct swab solutions, and then this is a comparison. And this is our clinicians said this is as good as you can get. Is they are really getting excited. It's only measure this particular virus, and then we did a different type of the virus, and then they did not have any reactions. I think that is important because you see people, the flu season is coming, and if people get the flu and a similar symptom, we needed to be able to differentiate. This is the COVID-19 virus, not flu, for example. And the sensitivity terms is very sensitive, and we can get down 10 copies per reaction in our own lab. And a big international organization validated our test. They have even fancier machines, but more accurate. They actually tell us their results is 1 copy per reaction. Okay, so if you have a single copy, and it will be detected. So at the moment, due to this, we actually, we put our detection limit at the CT32, and that is because we have to provide the figure. And then this CT32, this is a very low, is probably 10,000 per mil, of 10,000 copies per mil. And then this we actually can catch almost all infectious patients. So what we couldn't detect 100% reliably is actually people in hospital, and they are recovering. Okay, when you see they stay in hospital for a few weeks, and then later stage, they are still detected positive, but the viral load is very, very low. And then in that range, it's become less reliable. So we couldn't claim we can detect them reliably, but we still can detect some of them. So it's not that reliable anymore. So this is this company, Prenetics in Hong Kong. They actually evaluated our technology, our test. This is this table from them. They compared our test, compared the PCR test and antibody test and antigen test. Basically, of course, you want to show the advantage, then you just get this the indicators like speed, accuracy, mobility, and the labless, availability, affordability, and the throughput and the scalability. And then, so this is actually really ideal for POCT test, for point of care test. So they are thinking to roll this out into pharmacies and the airport and the schools. So our test brought a lot of attention all around the world. Okay, so as far as we know, in English-speaking world, there's reported actually over 14 countries. Actually, you got the influential one like CNN, BBC, ABC. They all have this special program to do that, to report that. And so in terms of research output, we have 2 papers already published. We have a couple in pipeline, and we filed a patent, 2 patents. And so it's actually a quite busy few months. I'd like to show you this little clip because this answers some questions, and this is actually a television clip. It's quite high quality, and give you some background information. And you can see that. If it's turning to yellow, look at that turning yellow, that's a positive result. So that means it's get virus. It's still like.
Professor Zhanfeng wants to release a test anyone can use at home to find out if they've been infected with COVID-19. He's been working on this since the outbreak in Wuhan in China.
It's a test the individual whether get infected and still infectious. So if I'm tested positive, that means I got the virus, I can spread the virus. I should go to isolation.
And this is how the test works. You take a swab sample, add some solution, shake it, add some more solution, put it in a test kit, another drop, and the solution becomes pink. It's then heated up to 65 degrees. either using a hot block like this or hot water. Leave it for 30 minutes and it's time for the results. The beauty of this test is in its simplicity. If the colour changes from pink to yellow, it's positive. If it stays pink though, it's negative. And the team here are hoping that eventually they can make this test so simple that we do it ourselves and at home. For now, Public Health England is testing healthcare workers at drive-through centres by taking a swab test. The samples are sent to a lab, and with so many tests to process, it can take up to 2 days to get a result. These scientists aim to release a quick test that can be carried out at clinics, pharmacies, even airports, and at home. Oxford University has made this project a joint collaboration with China. The university has a branch at Suzhou Industrial Park in southeast China, and half the team is working there.
It means we're able to react very quickly, and also key for us has been when the lockdown in China was happening, we could work here, and now that everything's switched around, we've got the ability there. We're less affected by impacts in transport, and we're able to make the best use of patient samples, hospitals and manufacturers worldwide.
And the interest in this test is global.
We like to issue like a royalty-free license and to manufacturers all over the world. It's non-exclusive. We had interest expressed from 14 countries so far.
In clinical trials in China, the test had a 100% rate of accuracy. It now has to replicate that in the UK. If it does, people here are one step closer to community-wide testing and ultimately getting back to enjoying life outside. Nicole Johnston, CGTN, Oxford.
Well, you get some idea. You also see some pictures about my lab and also in Oxford. So I have to say Oxford is actually a beautiful place. You're all welcome to visit us when this pandemic is over. And okay, so we got to the lab. We got to that. That clip is actually quite a few months old, and that's in I think March, April time. And then when we got the case, we said that we like to apply regulatory approval. And the UK equivalent to FDA is called MHRA. They said, no, you are a university. You can't apply this. So the university actually very quickly helped us. We set up a spin-off company we call Oxsed. So Oxford succeed, we say, Oxsed. So this company launched in 9th of January. At least, so that's all during the lockdown. So it's actually our group never had a lockdown. So because we're working on this special program. So we just keep a working distance, but we all have access to the lab. But then most of the people just working at home. So the lunch meeting is also like virtual, is online. So this is actually the day we launched the company. And nearly a month later, we actually get regulatory approval. This is, we got a CE mark, we got MHRA approval. So with the products, we call it Oxsed Ravid Direct. So direct means directly use the swabs with solutions without processing the samples. So Ravid stands for rapid virus detection. So Oxsed is the company name. So we got this all basically ready to launch the product. Okay, we got that is in July. And in August, our team awarded this Royal Academy of Engineering. This is the equivalent to National Engineer, what is it in the state? It is National Academy of Engineering. And we got our Royal Academy of Engineering President Special Award. It's called the President Special Award for Pandemic Service. And so there's a lot of this on the news. And it's a very big boost to the team because they have been working very, very hard in the last few months. So looking at this project, the timeline is actually, you see, the Wuhan started the lockdown 23rd of January, opened April 8th, and the UK had a lockdown 2 months later. And then the project started in January. And so we got a news release in March. First, the patent filed in later March, the 2 months from beginning. We have 2 papers come out. We launched the company in June. We got the product CE mark and regulatory approval in July. So basically, from the conceived idea, started the kick off the project to product launch is within 6 months. So this is really, really quick in any terms. So why we could achieve this? One of the particular reason is, I said, international collaboration. And because when Oscar was in lockdown, the work was started at Oxford. Our university here, they are very, very supportive. We have labs anyway here, but they said that this is not, even in January, late January, the university made it very, very clear that this is not a Chinese problem, it's a worldwide issue. So the university provide all the support they can give us, open all the labs for our team, and to operate. Because actually, most of our researchers are Oscar researchers. They don't have a lab here. So, but now the university just opened the lab to all of our team. So, and then when Oscar opened, so we can access reagent and consumables. This is all in China side because UK was in lockdown. And the very, very important aspect is that we have good people. So I'm very, very fortunate to have this very able and dedicated multidisciplinary team. So we have engineers, we have molecular biologists, we have medic, and all together. And so that is a very important aspect. So I mentioned the commercialization aspect. So we have social venture, we call social venture company, Oxsed Limited, funded. We have a manufacturer contract out to another university of spin-off company. And now, right this month, this week, next week, we can actually supply 100,000 tests per week. And the next month, we can supply 1 million per month. And then we can even increase more. But then, so this is actually get the industrial real production can supply this in quantity is also quite challenging. So the products is being evaluated in China, in United States of America, South Africa, India. I don't know why I wrote to China, and Saudi Arabia, and for regulatory approval. So back to the where this can be applied. As I said, we are not actually competing for central laboratories, and we are rather focused on point of care tests as decentralized testing. So this could be a little test hub in a pharmacy or in a van, mobile laboratories, just one man in the van driving around to test people. So the setup is actually less than 500 pounds, so $600. And then you can test 200 people a day. So 100 people working 7 hours, all right? It's not 12 hours a day, okay? So then we can take the sample in point of care testing. You take the sample, either swab, because the sample can be self-sampling, or if you need somebody take the samples, and that's needed to wear the PPE. And PPE means protection, personal protection equipment. And then you can use mouthwash, use gargling water. This gargling water, actually today, I think the CNN report, Canadian use gargling water and claim they are the first. Now I can tell you they are not the first. The first one is in Austria. Austria has been testing their school pupil by gargling for months. But then they use gargling water sent back to the PCR lab. And we use gargling water used to run our lab test. And the saliva, all fine. But then if you do POCT, one important step in beginning is before you do anything is to inactivate potential virus in case you cause infection. So what we do is that we use heat it up to 95 degrees for 5 minutes. And that's achieves the activation of the virus. Then you can open the cap and you can manipulate, take 2 drops, 25 microliter of solution, and do the test. And they're just heating it up, and then you can use a mobile phone app to collect the data and transmit the data. But that app is being developed, and because we needed to sort out the personal data protection and how to link to the national network system. Each country is different. But the test is far more ideally suited for actually self-test at home. Because the beauty of self-testing at home is that you don't need actually worry about the infection, okay? So you can take a self-test, take a self-swab or mouthwash and gargling, and then you just get thermal flask and get water for 65-degree water in a thermal flask, okay? That is 3 parts of boiling water, 2 parts of cold tap water at the temperature of 17, 15 degrees. You're adding it together, that's give you 65 roughly. To engineers, that's good enough. So you don't have to be exactly 65, it's 63 to 67, all fine. If you have a thermometer, it's even better, you can measure that. So you're just adding 1 drop of the sample to the tube, close the tube, put in the thermal flask, wait for 30 minutes, take it out, let it cool down, look at the color. So simple like that. So I think here is a game changer because we're talking about this. So if you see, for us, we have to change. One thing we might force to change is like this. First thing in the morning you wake up, it's not brush your teeth, not your morning coffee. It's to do a gargling with a mouthful of water, collect the water. The gargling, you can add in 1 drop of gargling water into the test tube, put the test tube in thermal flask with 65 degrees of water, then you'll go to shower and the breakfast. Okay, so you have to do your self-test first thing in the morning. Why first thing in the morning? Because at that time it's far more reliable because you haven't eat or drink, so you can collect the more virus if they have there. And then you can, after your breakfast, you can take the tubes out to check the color. If it's still pink, you'll say you have no virus, you go to work. If it's yellow, you stay home, you get isolation. So I do a little bit, this is a little bit demonstration I did for this President Award ceremony thing online. I don't know how to edit the video, so this is not high quality, but it show you how it works. So I give you a demonstration. Actually, you can see how easy it is. This is a test tube. So what I need, glass of water, I do a gargling. Okay, I do gargling. I use a cup, so you don't see what I eat at lunchtime. Now, and of course, this should be done 2 hours before any drink and the food. If you just had a gin and tonic, then your results are not reliable. So then, what I really need to do is, this is how simple it is. I got the cup, I open this test tube, I use the little pipette, I pick this. You can see this, you take actually the liquid, this is the sample, my mouthwash. I put it in to 1 drop, okay? So 1 drop, and that's what I need. This is the sample. Then the next thing I need is 65-degree heating source. 65 degree, okay, for 30 minutes. What I do in the home, I got the thermal flask, okay? So 2 parts of boiling water, 1 part of cold water, that's give you 65. Well, engineers, 66 is fine, 65. So what I do, I drop this in it. If you are not sure, your home you have thermometer you can measure. Then cover that up, leave it 30 minutes. Take it 30 minutes later, take it out, look at the color change. Now fast forward 30 minutes, this is what it looks like. If it's a pink, that's negative. I don't have a virus, I can go to your party. If it's yellow,
You see, this is the yellow is bad. You can see this turning to yellow. Then I go to isolation. So that's what we did. Okay. Beautiful children, if you children.
I'm trying to get this to move. Okay, so that's towards the end of my talk. So I'd like to thank Oscar, Department of Engineering Science at Oxford, EPSRC gave some funding, and then the collaborators. And without their help, their support, we can't do anything. And then thank you and stay safe. That's it. Finish.
Thank you very much, Zhanfeng, for a fantastic presentation, for your fantastic work to like a rapid testing of COVID-19, the worldwide pandemic. So now, please unshare your screen. I'm going to share the closing slides before you can answer the questions. So this is our next webinar presented by Professor Xinyu Jiang on October 17th. He's going to talk about microfluidics, nanoparticles-based theranostics for combating drug resistance. So please register on Saturday, October 17th. Please also follow Columbia BME on social media for the latest information. You can also get more information about WACBE by visiting wacbe.net. Thank you very much. Now we start the Q&A session. So any questions?
Zhanfeng, very nice talk. So what's the bottleneck right now to really, to implement it in US? Because US, still have a large number of cases, as well as, the testing is still behind. So what's your product's situation in US right now?
Well, we have a partner. Actually, we send the test kit to them, and they are evaluating this in a school setting. They want to test the children return to school. And also, you see, I think a lot of this is there's two major, I don't think it's a bottleneck, steps, important steps, and the limiting factors for wide application of the test. One is regulatory, because every country is different. So FDA got the emergency application thing, but you see, it's very foreign to us. We really need collaborative partners who understand the regulatory framework of each country. So in order to get that country, to get into that market. I think that is very important. So we work with collaborators. We have no means to go to, no knowledge, no means to go to different territories. So that's regulatory thing is very important. And then you see there is a lot of cases worldwide. It's very difficult to do clinical validation. This is very frustrating for us, engineers, scientists. We said, we have a great innovation. Why you don't use it? But you just couldn't persuade the clinicians to give it a run, because there's not many cases go to hospitals at the moment, for example. They are home isolation. So you actually, for example, for this mouthwash protocol, we have been waiting for at least 2 months. And to get all this sufficient number of patients or test positive people to do standard RT-PCR and our test, so you can do a validation. And the access to sample is a worldwide issue at the moment. Even like in China, for example, of course, there's also even less people get infected. I think that's another thing. Another big problem is actually this is another very boring thing is actually the supply chain logistics. Okay, so at the moment there's a worldwide shortage of the PCR and the LAMP test kits, the enzymes and the primers, right? Because actually your standard suppliers is New England Biolab supplies enzymes and the IDT integrated DNA, what is it? Yeah, DT technologies, and doing supplies primers, and both actually in America. Although they are worldwide, they have a lot of subsidiaries, manufacturer bases, but largely America. So then they have a big waiting list actually to supply this reagent. So it's very surprising for this pandemic. If you see who made the most of the money, is all this like diagnostic companies supply raw materials.
Hi, Savio, please.
Okay, congratulations, Zhanfeng. That was really inspiring, what you have done. I've been in San Diego because of the COVID. I couldn't go back to Pittsburgh, but I've learned that locally there's a company called Sorrento Therapeutics. I don't know whether you're familiar with them because they are working apparently with Columbia University or MIT, I don't know, do the same type of saliva test. Are you familiar with that company? And if you do, what are the similarity and difference?
Actually, well, thank you for the nice word. And you see, I don't know their company, and I come across the company because the reason is that there are many companies at the moment provide or claim or provide test kits already. So it's actually for all different ones. And some is antibody test, some antigen test, some of the nucleic acid test. And there is quite a number of LAMP, basically the similar technology based, LAMP-based tests as well. And then in the US, certainly there are like AEB labs, they have quite a few collaborators working on this. So I'm not particularly familiar with Sorrento, and maybe I will look at the website.
Yeah, they are actually, the CEO is a Chinese person, I'm not Chinese American, and they're trading, they're on the stock exchange and billion-dollar company or something like that. So anyway, I was just curious, but I'm so happy to see that a laboratory can actually do, you know, like when you say 100,000 tests a day, 100,000 tests a week, I think this is amazing. So congratulations. I'm so happy.
Thank you. Actually, the company is just a shell. We don't have a single employee. It's all the postdoc and the student working on the volunteers. Thank you.
Bimei seems frozen. There is a question here. Dr. Cui, thank you for wonderful talk. A great product from Liyuan Wang from University of Delaware. It is timely solution. My question is, number one, if the testing solution are stable in a large range of temperature, shelf life, is the testing solution stable in large range of temperature? Second question is, if the testing solution are safe to discard at home, right? Two questions. Yeah, one is whether it's stable at home, and another one is whether you can discard safely at home.
Okay, let me answer the second one. It's very easy. Is very safe to discard. So it's just like you can put it. Well, you see, if there's no harm if you put in the rubbish bin, the landfill. And then this is a particular one. When we designed this test, we kept that in mind. we can, you see, you could in a POCT in the clinic, you can recover like a clinical waste, but if you actually distribute it into homes, you can't recover that. So this is why we go for the virus inactivation using heat treatment instead of chemical treatment. Because if you do chemical treatment, it's much, much easier for virus inactivation. You just put the chemicals into the solution. But then you will have problem when you dispose that. So that's why we do heat treatment. That's no problem for that. The product is freeze-dried, okay? So in theory, it is very stable in a large range of temperature. And in low temperature, it's no problem. It's mainly worry about like higher temperature. If the reaction is 65 degrees, if your temperature gets to 65, it will react. That's what you don't want. But then one important thing is that because it's dried, it's move the majority, if not all, water. So the reaction can be depressed. So we don't have long-term stability data yet. So the longest, because we only have the products not long ago. So our the shelf life, we can guarantee, well, we have the data to support, is 3 months at the moment.
Great.
But it's every day is increase because we are actually doing the test.
Great, thanks very much. I think there's one question here, but essentially Eugene Golov from Leiden University in Holland, they want to contact you and then talk to, they have a team of students. So therefore they want to contact you. So I will suggesting Eugene to contact you through emails. I'm pretty sure you can find the Zhanfeng's email in there. So that's all the questions we have. And on behalf of Bimei, who lost the internet connections. Oh no, she just come back. So yeah, I was going to just close in the sessions for you, but Bimei let you close the webinar.
Okay. Anyway, thank you so much for the wonderful talk, Zhanfeng. And we'll like to see each other in October 17th. Thank you very much for all the people attending the seminar. Please enjoy the rest of your Saturday and Sunday.
Yeah. All right. Thank you.
Yeah, bye now. Thank you.
Bye.
Bye.
Bye. Bye. Bye. Bye.
Bye. I don't know what's wrong with my internet.
Yeah, bye.
Something wrong. Bye.
Yeah. Bye.
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 Good to see you.
Good to see you. Good to see you, Dr. Wu. Good to see you, Dr. Wu.